know. Good afternoon. Welcome to another AMA Ask Me Anything. I am Mayor Tom Dermody for the City of LaPorte, and joined today on our annual Tuesday, Dr. James Leonard, LaPorte Hospital. Welcome, Doctor.
Thank you, Tom. Welcome to be back.
Well, I think it's, you know, most people are here because they want to hear the COVID-19 update. If you don't mind, you know, what is the current situation, what's happening, and maybe talk a little bit about the peak, if we hopefully see a peak coming our way.
Yeah, sure. So we'll start off with the dashboard like we usually do most weeks. Overall, U.S. cases now up to 555,000. That's a threefold increase since we were here talking about this just 2 weeks ago. U.S. deaths total at 22,000. That's up 7 times since our last report. Indiana positive cases now up to 8,527. That's a fourfold increase. Deaths in Indiana, 387, also 7-fold increase compared to when you look at the overall U.S. Death rate too. Total tested in the state of Indiana, 46,000. LaPorte County here, we have 36 total cases in our county. That's including residents of LaPorte County, not necessarily that they went to LaPorte Hospital or went through the Porte Hospital system for testing, that they actually originated in the, or are residents of the county of LaPorte. So 36, that's a fourfold increase since our last discussion 2 weeks ago. Our neighbors to the west, Porter County, they have 127, that's a 6-fold increase. Lake County is up to 819, a 5-fold increase. In LaPorte Hospital System, we've tested 212 patients, 3 have come up positive, and there's 18 currently under investigation. We're getting turnaround times now on tests about 24 to 48 hours with the state now, so that's been very helpful. Currently in hospital, we just have a small handful, 6 to 7 patients under investigation. None of them are the intensive care unit. None of them are requiring ventilators at this time. We have 0 known positive cases admitted to the hospital at this point. So big testament to the county of LaPorte doing everything that it can and should to maintain social distancing, stay at home when possible, maintaining proper hand hygiene, covering your cough, things of that nature really has gone a long way, as evidenced by how our county is doing relative to our neighboring counties. Out in St. Joe County, they have 234 cases. That's a 5-fold increase. Marion County's up to 3,063. So there's some questions about our peak. Like, when is the state of Indiana going to peak? It depends on what indicators you use and what calculators you go at. University of Washington has a system that they apply, and they're putting our peak at actually today as our peak for the entire state.
And Doc, sorry, if you don't mind, pull that up a little closer to the mic so they
Sure.
can hear. Perfect.
So again, so the peak, some calculators are indicating that today is actually our peak for the state of Indiana. Others, you know, when you look down centrally, down in the Indianapolis area in Marion County, when they're considering the rate of positive tests coming back and considering the effects of the social distancing, they're thinking it may be more later in the month that we may peak. It remains to be seen, and it does have everything to do with how well each county continues with social distancing. They really push hard on an all-out, full-blown social distancing process and staying at home when possible. That's going to make a big difference. The better we are at distancing and reducing our daily number of increase in positive cases, the longer this will drag out. But the positive to that is that our hospital systems are not going to become overwhelmed. So every patient that does get sick enough to require hospitalization is going to get the medical care and attention that they need, which is critical.
So Doc, we have a couple questions, if you don't mind while I have you. Would it be a good idea to start testing healthcare workers in the area at this time?
So that is being done. Healthcare workers are part of the inclusion criteria for folks that have any symptoms, any fever, cough, body aches, sore throat, headache, things of that nature, those qualify. So any healthcare worker with any symptoms like that do qualify, and they will get tested, again with a turnaround time of about 24 to 48 hours. Currently, there's not enough test kits in our state to allow for testing of all healthcare workers that are, I'm referring to those that are not symptomatic. So far, it's still not possible within our state. So the tests are being allocated to those that are in most need, where getting the information back on a positive or negative test is going to help affect how we care for those patients. Very important to test patients that are returning to a nursing home or long-term care facility. Those facilities they're requiring 2 negative tests, so we have to allocate testing supplies to those subset of patients. So yeah, at this point, we really have to ration out the tests that we're able to apply.
So another question came up, and I know the public's ready, our community's ready to open the town back up, and ask, are we ready to open up May 1st, which more falls on my shoulders, but really what you're saying is, even if we've peaked, we want to be very cautious how we get back to normal and, get back to eating in restaurants and so forth until we really do the appropriate things that'll get us through this, or else we could extend it even further.
That's absolutely right. When when I discuss the peak or mention the date of April 14th of today as being the peak, that is absolutely relevant to us continuing to continue full social distancing. If we let up now, our peak is going to be, that'll come days, weeks from now, and can peak much larger in total number of cases and active cases at one time, in a situation that will inundate the hospital and overwhelm the resources capable of taking care of those patients. So a date of, if we go with one model that states that today is a peak, then that is assuming that we have full application of social distancing and everything that we're doing right now through the entire month of May.
Wow. So hang tight, we're getting there, but we still have more work to do in social distancing and protecting ourselves.
Absolutely. I think, the key message that I'd like to bring to everyone today is don't let up anything you're doing now. This is why we're succeeding with 36 total cases in our county. This is why we have available space, available ventilators, available healthcare workers, and PPE to care for the patients that are coming in that do require attention and medical admission to the hospital.
Is there a medical expectation that you want us in the community when we go to the grocery store, when we do have to go? Should everybody be wearing masks? Should they be wearing gloves? Is that a necessity you would recommend to everybody?
Yeah. The wearing face masks, absolutely. Homemade masks or anything you can get your hands on, they are very effective. The intent of the homemade face masks, the cloth masks, is to reduce the spread of your own respiratory droplets when you're out and about. It's a matter of keeping your respiratory droplets contained and not spreading it on to other people. If you're gonna wear gloves to the grocery store, you gotta remember that as you're touching objects in the store, if you were to touch one object and just put it back down, if that was already previously touched by someone else who may have had contaminated hands or dirty hands, you just put that on your gloves. And then when you go continue your shopping, as you pick up items and potentially put them back down, you're just spreading that virus along. So if you're gonna wear gloves, only grab what you're going to take and keep it with you in the cart and go pay for that. You can remove your gloves in the garbage can outside the grocery store. That's appropriate. If you don't wear gloves, that's acceptable too. Again, only touch those items that you plan to purchase. Make your shopping list ahead of time. Know exactly what you're gonna go and get. Grab only those things that you are going to purchase. When you get back home, wipe all your merchandise down and then wash your hands as well.
So another question is, how many hospital beds in LaPorte Hospital are filled with COVID patients? And it doesn't sound like many.
At this point, no. We're better off this week than we were last week and the week before that. Currently, as of today, there are no known positive cases of patients that are admitted to the hospital. There are, like I said, a small handful of patients that are under investigation, meaning they meet all the criteria, they have the appropriate symptoms, they have the risk factors, and they have been tested and their tests are pending. We expect to get results back within the next 24 to 48 hours on those patients.
And the question came in, will we be doing the antibody test as well in the near future?
Once those become available, we do have the analyzers. We have a couple different test analyzers at our hospital. We have a Cepheid machine, an analyzer there, that can give you a 45-minute turnaround time on tests. We expect to use those on patients coming into the emergency department, healthcare workers when the test kit supply increases, as well as, like I said, those nursing home patients. We could use it on those. We have the Abbott analyzers that you hear a lot about, but again, we're waiting on the test kits that come with those. That's gonna be more of a government release to allow us to get access to those. As far as the IgG, IgM tests, those are the antibody tests. Those are critical in regards to mass testing of the population, to know who has been exposed, who is now considered immune. If you have a high IgG antibody titer in that test, that suggests that you have an immunity to the virus. The more we know about our overall population, the more accurate we can be on allowing everyone to open up and get back to life as usual. That's a critical piece. We need to get our hands on those IgG, IgM tests.
Also, as a reminder to the community, if you're interacting with a first responder, if the police, the fire, EMS are coming to your house, we've had a couple instances where family members would not share direct information whether an individual has an issue, has shown symptoms, or is currently being tested for COVID-19. And when asked, they would not be forthcoming on information until after the fact. Please, in the public, if you're interacting with the police, the fire, and they're asking you questions, please share the information if somebody is thought to have COVID-19 or is being tested or showing symptoms, so they know going in. That's very important to keep our first responders safe.
Yeah, thank you. There's no downside risk to being honest about that information. It's just a matter of protecting yourselves, protecting your neighbors, protecting those first responders and healthcare workers that are there to support us.
How long can someone remain asymptomatic for the virus? For example, if someone was around potential COVID-19 infected people but not sure, therefore assuming for safety purposes that they are asymptomatic, how long could they be carrying it with no testing available to be sure?
So it does depend on the patient, on the person, and how much viral load, we'll call it, that you get exposed to. If you've been exposed to a high viral load, and you get it, exposed strongly to that, where you're beginning to develop, your body's mounting an immune response to it, but you're not demonstrating any symptoms, thus making you asymptomatic. You could be a carrier for up to 14 days. If you're exposed to a low viral load and your body mounted an immune response to it, again, keeping you asymptomatic, it could be as few as 7 days. The Indiana State Department of Health uses criteria to determine when to remove transmission-based precautions to patients that are in the hospital or those that could be going home or back to a nursing home or skilled care facility. And they recommend anywhere from 7 to 14 days. It depends on the patient, but they use a date as low as, or a length of time as low as 7 days sometimes. So it's safe to say, if you think you could have come in contact with someone, or you were known to come in contact with someone that became positive for COVID, the safest thing to do is to use the 14-day time period to keep yourself distanced and quarantined from others, so that in case you were an asymptomatic carrier, you don't have any risk of spreading. Again, maintain that meticulous hand hygiene, carving your cough, keeping your distance. If you do those things, the likelihood of you transmitting to anyone else is extremely low.
We also had a question, is hydroxychloroquine available to a potential patient that would request it?
It is. The Porte Hospital does have access to and supply of hydroxychloroquine, as well as some other medications that are currently considered what we call compassionate use. That means that there's no controlled studies, randomized controlled studies with enough research to really formally suggest or prove that they are effective, but there is a lot of case-by-case studies that you're looking at that does show that these medications do have promise. And because of that, they are being released for compassionate use, and the hospital does have those available and ready to use for those patients that may require it.
So is it possible that a healthcare worker could be asymptomatic and not know it?
Yes, that's true. So that's the point behind every healthcare worker when they are around any patients. They have a surgical mask on. If they're involved in any aerosolizing procedure, they have an N95 mask on, plus a face shield, the gowns, the gloves, the entire PPE to prevent the spread. And it's been proven that when using the proper PPE, that the likelihood of spread is extremely low. So having an asymptomatic healthcare worker around patients while wearing the proper PPE, risk of transmission, like, as I say, is extremely low.
And would it be ridiculous to say the reason we're doing as well as we are doing is to not overload the hospitals with sick people? And would it be ridiculous to say the same amount of people will die over time? I'm not sure, but I think the overload is key, not overloading the hospital, and we're in a good
That's right.
position.
The last thing you want to be do is flipping a coin, making a decision as a physician or another healthcare worker on who's going to get a ventilator or not. At this point, we're not remotely near that scenario, and we don't ever want to be. So again, continuing the social distancing and which controls our numbers, our daily numbers of positive cases, and those that come in that are symptomatic that require hospitalization, there's enough resources at this time to manage all of the patients that need the proper care. Where those that need ventilators are getting them, those that need additional respiratory support, they're getting that. If we let loose on this social distancing now, and we receive too many patients that are requiring hospitalization and intense medical care all at the same time, we will overwhelm our resources very quickly.
Do doctors and nurses have enough PPE, and how much has been made and donated? And I'd like to just put a shout out there to Rosedale Filters making masks, Sterno Delivery also making masks, Prairie Packaging doing hand sanitizer, producing that, and then also Sean Fear with Watto Scrapyard. He was kind enough and he produced face shields. So it's pretty neat to see how the community is responding and providing PPE for the nurses and doctors that are in need of it. But how is the inventory overall?
Yes, overall, I would also like to extend a very sincere thank you to all the members of the community, businesses and individuals who have stepped up to make masks, face shields, all the donating of other forms of PPE is very much appreciated and well utilized. We have received some donations of face shields to the number, I said we're doing about 50 to 75 of those now, and I hear we got more on the way. I'm very excited about that. That is going to be very helpful, and they will be utilized. Currently, yes, the hospital and all the healthcare workers do have enough gowns, face masks, N95s, gloves that they need at this time to properly care for the patients and protect themselves as well.
And if a patient, the other question was asked, if a patient does have COVID-19 and is admitted into the hospital, are they isolated from other, how does that work, from other patients?
Yeah, so the hospital does have dedicated negative pressure rooms and negative pressure units, whole units, where these patients are placed. Negative pressure meaning that the direction of airflow keeps the air that the patient is breathing and exposed to in that room. It doesn't go out into the common area. So there's a negative pressure room, again, for proper airflow, and there's a regular, what we call an IMC or intermediate medical care unit, which is like a step down to the intensive care unit. There's an entire unit dedicated for COVID patients or COVID suspect patients. There is a ICU level of medical care unit that's also dedicated potential COVID positive patients as well.
I'd also like to, we've had a couple questions, where can I get a mask, where can I get this for individuals? And, you know, they're hard to come by right now because the focus are the healthcare providers. But I would like to put a big thanks out to Maria Fruth and the Healthcare Foundation. And if you haven't had an opportunity to go to their website for the latest COVID updates, it's hflaporte.org, and go to the COVID website, or I guess that's the proper term, and get the latest information, because really in the city or the county of LaPorte, that's the place to get your latest contact information and updates.
Right, you can go, cdc.gov has a great section under the COVID portion related to how to make your own face masks at home. I was just looking at that today. It was pretty impressive. It's all spelled out on how you can do that there. But as far as surgical masks, if you have extra surgical masks, a big supply of surgical masks somehow, some way, the hospital could really use those. They are just as effective as the cloth masks when you're out and about and in the out in public when you're doing the shopping, and you have to, you know, you're worried about potentially coming within a 6-foot distance within other folks. Again, a cloth face mask is just as effective as a surgical mask in containing your own respiratory droplets, so.
What about, I've been using sometimes a bandana. Is that not appropriate for public grocery shopping?
No, it's just, almost just as good. When you go to cdc.gov, and when you read through there, it'll explain certain types of fabric that are a little bit better at others at filtering. The duck cloth type of fabric is better at filtering than some of the other types of fabric that are out there. So most bandanas they're better than nothing. A bandana is better than nothing, but a duck cloth type of a fabric cloth mask will do a better job at filtering.
And we're still promoting exercise. We want people to get out there, but do the necessary social distancing to do your part.
Right. It's been hard on everybody. Thinking back how long we've been hunkering down here and dealing with this, everything you can do to try to maintain some sense of normalcy is very important. Reach out to your loved ones, phone calls, texts, do what you can there. Get as much exercise as you can in at home if possible. Eat healthy, get plenty of sleep. Again, just lean on each other but try to keep your distance as well.
And I would like to remind everybody, our park system, we have, I believe, the best park system around. Mark Schreiber and our whole park department do a great job. And our natural resources, use our parks. But please stay off our equipment because we cannot sanitize enough to keep it clean based on the usage. So please stay off there. But as well, we've had a run of graffiti and some other damage to our parks. We have the police on the watch, but families, everybody, respect what we have out there. We would hate to have to close the park at some point because we have individuals that can't appreciate what we have. So please use it respectfully, but stay off and quit damaging city property.
Yeah, as far as getting closer together and intermingling with other folks at this time, it absolutely is true that if you do that, you're increasing your risk of contracting the coronavirus. There are, when I talk with patients and hear of patients that are admitted at hospitals within our network, they can tell you very clearly where they were at and where the episode was, where it could have occurred, where they came in contact with someone that had that did test positive. They were known, they test positive a week after they were talking to another friend or family member that they were in contact a week earlier who had tested positive before they did. So again, to get back out there too soon and begin to intermingle and close down our social distancing regulations and recommendations is just, it's too early to do so at this point, to be honest.
And when people need to be tested, they feel like they have symptoms, is the best thing, and I'll give this hotline number out, 1-833-576-3627. The hotline is 833-576-3627. If you feel like you're having symptoms, that's the starting spot here in LaPorte, correct?
Right. Call that number, and when you do, you're going to be on the line with a nurse that will begin to ask you a series of questions about the symptoms that you have. Depending on that, you're going to very likely meet ISDH criteria for testing, and then they'll refer you out to the Sagamore Clinic near the or adjacent to the Urgent Care Center out there, and they'll perform the test. So make the phone call first. Go through that series it's just a short list of questions that'll be asked of you, and after you've gone through that process, it'll be deemed whether or not it's appropriate for you to go in and get the swab and get tested.
And then it's basically a drive-up test, correct? I mean, people have asked, do you have a drive-up test? This is a drive-up test once you are confirmed you need to take one. That's
right. Once you've been found to be in need of the swab and the test, you will be told, given a time to come in, like they'll make an appointment, and you pull up into the parking lot there, and the healthcare worker will come out in full PPE, greet you right out there when you're in your car. Don't even need to get out of the car, and they'll swab you right there and take the sample back into the building, and you'll be on your way. And they'll give you some more information too. They'll contact you with what's called a LIM number. That's a trackable number. I was just on ISDH website through in.gov today, and when you're given your own LIM number, I think online they called it a PIN number, a PIN, personal identification number. You can track your own results there too. So, but you will be notified. To be clear, You'll be notified from the hospital system as well. The hospital system will get notified of your result, and they will be contacting you if you're either positive or negative. Either way, you will get that direct call.
And, there's some question, because our numbers are low, that doesn't necessarily mean we're testing less than other counties, correct? Everybody's going through basically the same process, the same questions. We had some individuals from South Bend where they were in the process of being considered COVID and needed tests, and they had to call a hotline and see if they were, had the questions, if they were positive and needed to be tested or not.
Yeah. Far and away, across our counties, it's pretty evenly spread as to how many test kits each facility has and their ability to test. That's why most healthcare facilities are relying heavily on ISDH criteria. So they are, and all those criteria being, those questions are identical no matter what system you go through. You'll be asked the same questions. You will be screened in as requiring a test or not the exact same way no matter where you go. So those that are requiring tests are getting the tests, and that's no different from county to county. So again, when you look at within our own county and the small number of total tests done and the small number of total positives that have come back within our own county, it is nothing else but a testament to how well this county is doing on the social distancing and the personal hygiene.
Can the doctor address changes to EMS protocols?
Yeah, they would, yes. What our county EMS is doing, well, number one, they want to get information first. If they get a 911 call, they will be asking. There's some screening questions that are asked as well. It's not going to delay their response time. They're coming right to you if you have need. When they arrive, they are going to ask some questions about certain symptoms that you may have or any exposures or things of that nature, and they will be ready to go with their full PPE. They will care for you otherwise identical to any other day. And then if you need medical attention and you need to be sent to the emergency department for evaluation, they will transport you there. So really, you shouldn't see any difference on the quality of care that that you will receive from them. They're doing an excellent job.
And Bob Killian reminds us, when you jog, when we're out exercising, you breathe droplets, trail behind you by as much as 6 foot, wear a mask. If you're running with somebody, don't trail behind, go 6 feet apart, side by side. I don't know if that's medically correct, but it sure makes a little common sense.
It makes a lot of common sense, right?
Common sense,
right.
So be appropriate. And then the typical processing time for a test, with the goal being 45 minutes, which are hard to come by right now, which eventually we may have, LaPorte may have. Right now, you said 24 to 48 hours?
Right, with the majority of the tests going down to the state for testing, they are now improved their turnaround time to 24 to 48 hours. When the state got inundated, when this first thing hit, when this first hit us, they were getting inundated with the number of tests that they had to run, and just going, there was a time when they were turnaround was about 5 to 7 days, and they've done an incredibly great job of reducing that turnaround time and getting all the facilities test results back within the 24 to 48 hour time. Again, yeah, the hospital system does have the other test analyzers to be able to perform these tests directly themselves. The issue has been getting our hands on all the test kits and all the components within each test kit to be able to do them ourselves. Once those are freed up and allocated to us, we should be able to turn around tests much quicker. We are told that we have a supply of test kits that go along with this machine. It's called the Cepheid analyzer, and we're getting a very large number of test kits coming in within this week, and those again are going to be allocated to patients coming into the emergency department, patients that are being admitted to the hospital, and those that are being prepared for discharge from the hospital back to a long-term skilled facility.
So, and I don't think you can probably answer this question, is EMS withholding intubation in the field? Probably not up your alleyway, but I'm sure there's a lot of caution that's taken place.
They were right. So where it's absolutely indicated, they will do so. But you're right, they are trying to do everything they can to withhold intubation if it's not absolutely indicated there in the field. There's many other ways of bridging, oxygenating a patient and ventilating a patient to get them safely to the emergency department, where if an intubation needed to occur there, it would occur there.
So I also want to remind everybody the Retail Responsibility Act is still in effect, where we're asking only one member of a family to go shopping at a time. As well, the retailers are keeping 2 individuals per 1,000 square foot of retail space in the building at some time. And I want to thank the community. It's not the most fun. It's not something that I enjoyed putting into effect, but maybe that has some relation to the low numbers in LaPorte County, because we are the only county and community with Michigan City that's put those requirements into effect. We want to release those as quick as possible, but we also want to be healthy moving forward. So if you have questions about that, you can reach me on my cell, text me at 363-7293. While we're waiting for a few other questions, again, just remember the parks are open, but stay home if you're not out to exercise, if you're not doing what's essential. And there are businesses in LaPorte that are considered essential. And we've had a lot of people calling, why are they open? And I can tell you this, we found out firsthand that the governor's task force is out and about, and they were in LaPorte this past Saturday. And they are not hesitant to pull a license for businesses that should not be open during this difficult time. So we saw that firsthand. Make sure that if you are essential that you're open, but otherwise, if not, the governor's task force has been out and about, and they will be checking on your business. As well as that, a couple points that I want to make with the uncertainty of the current situation. The spring cleanup that was scheduled for May 11th through the 15th, we will delay that, and then hopefully once we get through this, there will still be a spring cleanup, but it will not be May 11th through the 15th. As well, the waste, yard waste, you're just going to have to hold on to, and that's not fun as well. But until the county solid waste opens up Ziegler Road, which they will evaluate that on the 21st, we can update you from there. But we're asking in the meantime, everybody, take 5, and this is kind of our new, Doc, first time you're hearing it, the new Take 5. Take 5 minutes to walk around your home, clean up any trash that may have debris that may have been dropped in your yard, and your business. We want LaPorte to be spotless. If you've had a minute, Mark Schreiber and the LaPorte Park Department, as well as Mike Fraze from the Street Department, if you look at Newport Landing on the east side, we have gone through last week and cleaned that up, and we want it to be spotless, but we want our community to be spotless. So take a couple minutes. I think while you're walking, use gloves, use a trash bag, do the social distancing, but we need your help to take 5, and let's clean up LaPorte and make it special. As well, no wipes in the pipes. It must be connecting, because we've had no blockages in almost a week, so we'll continue to promote no wipes in the pipes, and do your part there. A reminder, City Hall is open via telephone, and you can reach us at 219-362-3175 if you have a billing question, or call me at 362-0151 in the office, or again, my cell is 363-7293, or follow me on Tom Dermody LaPorte Facebook page. But again, Annette is always there. She is the glue that holds this office together, 362-0151. And let's all do our part as well. I think 4th of July parade, our goal is to still have it. And Doc, if we do our part now, which you've been promoting, we want to have, because we are the capital of Indiana for a day, we want the 4th of July parade to happen. So Doc, we got to do our part, right? Social distancing.
If we keep this up, we can, if we keep doing what we've been doing, then April 14th, today, will be our peak, and we'll get through this. So I just can't overstate the importance of just keep it up. Just hang in there, a couple more weeks with this, a few more weeks with this, and we'll get through this. Let's make today our peak.
And just a couple other questions, if we could, Doc, or a couple statements. Again, people want to know how many cases, and again, you're testing a fair amount of cases. We just don't have a lot of positive results off the test that you're going with.
Right. Every patient that needs a test, meaning a test result is going to affect their medical care and affect the safety of those that are around them and themselves. Every one of those patients is getting the test. as we discussed earlier. It's just the same throughout the entire state of Indiana. Our lower numbers in this county are relative to the point that we don't have as many patients that fall into the category of being higher risk and most likely to be actively infected and symptomatic. So, and again, that has everything to do with what we are doing as a society here in LaPorte County, just doing this right with social distancing and everything else that you're doing. So please, please keep it up.
And as well, we were just asked how, Michigan City has all the boat money. How is LaPorte doing? Really, LaPorte has to be like most homeowners. Those homeowners that might be struggling, being laid off or not having full hours, and they have to cut back. Well, we're doing the exact same thing. We're being responsible. We're looking at our expenses. Our department heads are fantastic, and we know these are going to be difficult times, and we're being responsible. We're not putting on a bunch of new hires, seasonal hires. We're also looking at, any acquisition or purchase for over $500. And the neat thing about it is we've got some responsible, department heads that are doing their part to know that, hey, we can't do more than what we're asking our residents to do that are having difficult times. So we're trying to be as responsible as possible, and we will continue to be that way. Again, and we are treating it like a business. And then before let's see.
Mayor, Ada
Yes.
would like to know the difference in symptoms between the cold or the flu and COVID-19.
Yeah. So the question, is that heard by all already? Difference in symptoms between those who may have a common cold versus influenza, respiratory influenza virus versus this COVID-19. Quite no difference at all. There's really hardly any difference. A typical cough. It's not common for COVID-19 infected folks to be sneezing, but at early onset, one of the first symptoms could be something as simple as just some sneezing, mild sore throat, and then the cough. Fever is more common with this COVID-19, but that is also common in respiratory influenza. There really is no discernible difference symptom-wise between respiratory influenza virus and COVID-19. So again, consider your symptoms. You don't have to dismiss your symptoms as a common cold. That could just be the early symptoms that are under control at that point, and your immunity is keeping up with the infection. And you can go from a controlled situation to an unstable situation with your own symptoms in short order. So if you do have risk factors for having a more severe illness secondary to COVID-19, you should get checked out. So again, if you're over, those include folks that are over age 65, that have diabetes, heart disease, asthma, COPD, other lung conditions, those with any immunocompromised state, cancer patients receiving treatment, those are all in a higher risk category. And if you do have just simple cold-like symptoms, go ahead and make the call to the hotline there that was mentioned earlier, and you'll be screened, and if necessary, you will be tested. Even without the test, it's so important to discuss this as well. Even if you don't have the test, and it's uncertain if you are positive or not, if you are short of breath, if you feel that your condition is unstable in any way, the hospital will see you. You can go to the emergency department. If you feel that the need is to call 911, then do so. You'll be assessed in the ER. And if your condition is severe and to require hospital admission, you will be admitted. And if you weren't tested before you got admitted, you definitely will be tested when you are admitted. It doesn't take admission to get tested, though. Again, if you do have any of those comorbid conditions, we call it, 65 and all the other things I mentioned, anything like that with cold-like symptoms, just make the call to the hotline. Again, it's 833-576-3627.
And how can the community support and say thanks to all our healthcare workers? I notice here with the hearts, which I also mentioned, Reprographic Arts in the city of LaPorte is printing out hearts. They can do all colors, putting them up in the window. Doc, how much does this mean, and what else can people do there?
Yeah, thanks a lot for bringing that up. So again, I can't say just how proud I am of all of our healthcare workers, our first responders, and all that they're doing to keep our city and our county safe. There is a program called Hearts for Healthcare Workers and First Responders. The idea is to create colorful hearts, display them in your windows, take some pictures, send them to the hospital, you can send them to the mayor's office, you can post them or link them up at laportehealth.com. They would love to see those pictures and share those throughout the hospital. So great way of showing your thanks. It would be very much appreciated.
We appreciate Reprographic Arts and all that they're doing as well. Tim Frankie, sitting to my right, from Dunlin Media, all the effort that he's taken out of his busy business day to come make sure these are live, because we're going to continue AMAs once we beat COVID, and we will be all right. We will get through this. Jessica Bruder and I will be continuing the AMAs, and our goal during this time, when Dr. Leonard's not on, say on a Friday, we've already had another request from U.S. Senator Mike Braun to come back on. He appreciated the time and the quality of interaction that he had with all of you. We're also looking at other groups or other organizations that we can put on the AMA that will help all of you that are sitting at home participate in different type of art, exercise at home, and kind of give you tips and so forth. But the key is to get the weekly update from Dr. Leonard. And if, again, one thing is, I saw Norma on here said LaPorte's doing a great job of social distancing. Well, I want everybody to know, per Norma, cruise night is on. We probably won't be able to do it in June, but everybody's going to be ready. Cruise night is a wonderful time, and it just might be a different date. And if you have questions, text me 363-7293 or call Annette at 362-0151, my chief of staff, or as most people recognize her as, the glue. That's all they recognize her at. And Doc, do you want to close? I'm going to let you close here as we finish up, to just remind people till next Tuesday. We hope we'll see you next Tuesday.
Absolutely.
And give an update. Any thoughts?
Yeah, so again, please keep doing what you're doing. It really is paying off. It's making an immense difference, and it's what's going to keep all of us safe and keep us able to receive the medical care that we need should we come ill and have to get to the hospital. When you look at states look to New York, look to New Jersey, those are war zones in those hospitals, and there's just some terrible, horrible things that are occurring out there, and so sad to see how inundated and overwhelmed those physicians and nurses and other healthcare workers are trying to care for those patients. It's just a terrible thing, and they need help. And it's hard to dig out. And at this point, we're not digging out. We're keeping up. So the more we stick to this now, the overall shorter duration of us dealing with this whole COVID-19 situation in our county, the shorter that will be. So keep up the good work. Can't stress it enough. Thank you for all that you're doing.
Great. And Arts in the Park, we agree with you. We hope that Arts in the Park, we believe they'll be open this summer. And again, I'm going to read that hotline one more time, 833-576-3627 if you feel you have any symptoms. Also want to mention Slicer Pizza Day. Domino's, thank you so much for your sponsorship. This week will be Bethany Church that's sponsoring 200 pizzas at 2 o'clock on Saturday at the I Street parking lot. Line up quickly, because 35 minutes, 200 pizzas were gone last Saturday, so you better get there early. And if you have social media opportunities at your business, please call Tim Frankie or look him up on social media, Tim Frankie, Dunlin Media, and thanks to them for their sponsorship. We will see you again this Friday, 3 o'clock. Have a great day.